Welcome to your Health Facts podcast. Today, we're going to be talking about the connection between common medications and potential liver damage.
Okay.
Your liver is like a powerhouse.
Mm.
It filters your blood, helps with digestion, and restore your energy. It's constantly working, though, and that unfortunately makes it kind of susceptible to harm,
Right.
even from substances that are designed to help us.
Exactly. The liver is crucial for metabolizing medications. When medications travel through your system, they're processed by the liver,
Okay.
and the liver inactivates them and prepares them for elimination, either through feces or urine. This detoxification process prevents medication buildup, which could be harmful.
Yeah.
But ironically, sometimes during this neutralization process, the liver generates toxic byproducts.
Oh, wow.
Yeah, so the very medications we rely on can actually pose risks to the liver.
That makes sense.
Yeah, potentially causing drug-induced hepatitis, which is a condition where the liver gets inflamed because of excessive or inappropriate medication use. Medications known to be tough on the liver, like acetaminophen or Nemslide, can significantly increase the risk of developing, acute or even fulminant hepatitis.
So let's take a closer look at 5 commonly used medications that can impact liver health.
Sure.
We've got Tylenol, diclofenac, amoxicillin clavulanate, statins, and amiodarone.
Okay.
Tylenol, or acetaminophen, is generally considered safe when taken as directed, but going over that maximum daily dose of 4,000 milligrams or using it chronically can lead to liver damage.
Right.
And it's important to remember that even a single large dose can cause serious harm, requiring immediate medical attention.
Absolutely. Liver function tests, or LFTs, are blood tests that measure the levels of liver enzymes.
Okay,
And elevated levels of these enzymes can indicate potential liver damage.
gotcha.
So these tests are really important for monitoring liver health and detecting any potential issues.
Diclofenac, often sold under brand names like Voltaren or Cataflam, is an anti-inflammatory medication used for pain relief.
Mm-hmm.
Oral ingestion of diclofenac has a higher risk of liver injury compared to topical applications,
Right.
like gels or creams.
Exactly.
And that's because topical application leads to lower absorption into the bloodstream. Chronic daily use of oral diclofenac, especially for periods over 4 weeks, and at higher doses, increases the risk of liver damage,
Yeah,
particularly for those who are, already predisposed to liver issues.
absolutely. And, while the liver's drug and activation process is generally consistent across individuals, it can vary. This is why some people experience sensitivities or adverse reactions to certain medications.
Okay.
Their livers might process drugs at different rates, leading to varied levels of drug accumulation and byproduct production.
Interesting.
Yeah. And this variability really highlights the importance of close monitoring of liver function during treatment with certain medications.
Amoxicillin clavulanate, commonly known as Clavulant, is a combination antibiotic used to treat various bacterial infections. And surprisingly, it's one of the leading medications associated with liver damage.
Wow.
While the exact mechanism isn't fully understood, it's believed to cause liver damage through an allergic reaction within the body.
It's really important to understand that some medications can provoke a severe immune response that can lead to liver damage.
Right.
So being vigilant in observing any signs of liver injury is crucial, especially when taking medications known to potentially affect liver health.
Next up, we have statins, which are widely prescribed for managing high cholesterol levels.
Right.
While they're generally effective, they carry a risk of liver injury.
Yeah.
Some examples of commonly used statins include simvastatin, orgevastatin, and rosuvastatin. Statins can potentially cause liver damage, either by producing a toxic metabolite during their breakdown or by triggering an allergic reaction.
Yeah. Drug-induced liver injury is definitely a serious concern, but it's actually relatively rare. To determine if any of the medications you are taking carry this risk, you can check the adverse effects section in the drug leaflet.
Okay.
If you see anything about a risk of hepatitis or other liver diseases listed there, don't panic, but have an open conversation with your healthcare provider about any medication-related concerns you have.
Amiodarone, a medication used to manage irregular heartbeats, can lead to elevated liver function tests in a significant portion of long-term users. While these elevations don't always indicate serious problems, a small percentage of users might experience more significant liver damage. The FDA has actually placed a boxed warning on amiodarone
Oh, wow.
to alert both patients and healthcare providers about its potential to impact liver health.
Interesting.
Regular monitoring of liver function is crucial for those on this medication, particularly those taking higher doses for extended periods.
So, we've been talking about medications, but let's shift gears a little bit and talk about supplements.
Okay.
Supplements are often seen as, inherently beneficial, but they can also pose risks to the liver.
Oh, really?
Yeah, certain supplements have been linked to liver damage. This includes things like bodybuilding supplements that contain anabolic steroids, weight loss supplements that contain green tea extract, and high doses of some vitamins like niacin.
Hmm.
Herbal products like ginseng and black cohosh, along with those multi-ingredient nutritional products, can also potentially harm the liver.
It's interesting you say that because a lot of people think supplements are, harmless because they're natural.
Right, exactly. But, just because something is natural doesn't mean it can't have potent effects on the body.
Yeah, that's a good point. So what are some early signs of medication-induced liver damage?
Well, the liver is actually a very resilient organ. It can withstand a lot of, forms of injury,
Okay.
but if left unchecked, it can deteriorate quickly.
Oh, wow.
Yeah, and fail within days. Symptoms often begin with, things like nausea and vomiting, and then progress to severe abdominal pain, and then in extreme cases, coma.
That's scary.
Yeah, it is. It's crucial to monitor your body, pay attention to those symptoms to detect potential liver damage early on.
Okay, so let's go back to the supplements you were talking about.
Sure.
Could you give some more specific examples?
Yeah, so bodybuilding supplements often contain anabolic steroids,
Right.
and those can cause, significant liver damage.
Okay.
High doses of green tea extract, which is common in weight loss supplements, can also put a strain on the liver.
Interesting.
And excessive intake of niacin, which is a vitamin found in a lot of supplements, can lead to liver toxicity.
Wow.
And certain herbal products like ginseng and black cohosh have also been implicated in cases of liver damage,
Okay.
and as have multi-ingredient nutritional products with complex formulations.
It sounds like it's really important to be careful with supplements.
It is. It's crucial to approach the use of dietary supplements with caution and, consult with a healthcare professional before starting any new regimen, especially ones involving high doses or long-term use.
So what are some specific early warning signs of liver damage that people should be aware of?
Well, some early warning signs can include things like stomach pain, fever, diarrhea, dark urine, and jaundice, which is that yellowing of the skin and eyes,
Right.
nausea, vomiting, extreme fatigue, skin rashes, and pale stools.
Those are a lot of different symptoms.
Yeah, and if you experience any of these symptoms, it's really important to seek medical attention immediately.
Okay.
It's worth reiterating, we've been talking about these 5 common medications that can potentially cause liver damage,
Right.
but there are other drugs that might carry similar risks as well.
Okay.
So to be sure, you can refer to the adverse effects section in the drug leaflet.
Right.
And if you see anything about hepatitis or other liver diseases listed there, don't panic, but definitely have a conversation with your healthcare provider about any concerns you have.
That makes sense.
It's important to remember that drug-induced liver injury is a serious condition, but it's relatively uncommon in the general population.
So what are some things people can do to protect their liver and minimize the risk of medication-induced damage?
Well, I think the most important thing is to follow the recommended dosages of medications and supplements.
Right.
Exceeding those prescribed limits can overload the liver and, significantly increase that risk of damage.
Yeah.
Maintaining a healthy lifestyle is really important too. A balanced diet rich in fruits, vegetables, and whole grains. Limiting processed foods, saturated fats, and sugary drinks. And regular exercise is also really beneficial because it helps maintain a healthy weight and improves insulin sensitivity, which reduces the risk of fatty liver disease.
So alcohol consumption is something that people should be mindful of as well, right?
Absolutely. Excessive alcohol intake can severely damage the liver. It can lead to things ranging from fatty liver to cirrhosis.
Wow.
So if you choose to consume alcohol, moderation is key. Adhering to those recommended guidelines and avoiding binge drinking can help minimize the risk of liver damage.
What about interactions between medications and supplements?
Yeah, awareness of potential interactions is essential.
Okay.
Certain combinations can amplify the risk of liver damage. So always inform your healthcare provider about all the medications, supplements, and herbal products that you're using,
Right.
just to ensure their compatibility and safety.
That's good advice.
Yeah, and your liver is an essential organ. It's responsible for countless vital functions. Taking those steps to protect it is crucial for overall health and well-being.
Okay.
And if you have any concerns about your liver health, Consulting your healthcare provider is always a good idea.
Right.
They can offer personalized advice, conduct necessary tests, and guide you towards the most appropriate course of action.
Great. Well, thank you so much for all of this information. It's been incredibly insightful.
You're welcome. I'm glad we could talk about this.
So we've been talking a lot about the risks,
Yeah.
but let's talk about how amazing the liver is at processing medications.
Yeah, it really is incredible. For a lot of medications, their journey ends at the liver. That's where they're inactivated and prepped for elimination from the body.
Wow.
And that elimination typically happens, through feces or urine.
Right.
This detoxification process is so important. It prevents the buildup of medications that have, served their purpose and could become harmful.
That's fascinating. It's like this protective mechanism that's designed to safeguard us,
Yeah.
but then sometimes it can ironically endanger the liver itself.
Yeah, it's a delicate balance for sure. During this neutralization process, the liver can sometimes produce, toxic compounds.
Right, right. So it really emphasizes the importance of being mindful of what we put into our bodies and, understanding how our medications can potentially impact our liver health.
Absolutely. It's all about being informed and having open communication with our healthcare providers.
Well, thank you again for joining us today and sharing your expertise on this important topic. And for our listeners, if you'd like to learn more about liver health and other important health topics, be sure to subscribe to yourhealthfacts.com.